What types of surgeries are performed in blue eye? Hello, I'm Cattai Daniele, head of surgery at the Blue Eye Clinic. In our clinic, we carry out interventions that cover the world of ophthalmology at 360 degrees. We do cataract and retinal surgeries and also what concerns the eyelids. Today, I want to answer some questions that patients can ask themselves before surgery. How is the patient prepared for surgery? The patient must be present at the clinic about an hour before in order to prepare the eye in the best possible way. How is the preparation done? The patient is made to sit in the waiting room and eye drops are instilled, which are used for dilation and anesthesia of the eyeball. An interview is also made with the anesthetist who examines the blood tests brought by the patient and together with the doctor decides which type of anesthesia will be best for the case and for the intervention that will have to be undergone. It is preferable to always fast before surgery and in comfortable clothes. Obviously, before the surgery, the patient is changed into disposable clothes present directly in the clinic. It is always best to be accompanied as it is never advisable to go home after surgery alone. What happens during the surgery? The interventions are carried out in the operating room, a sterile and aseptic environment. The patient is monitored, therefore always under the control of the anesthetist and doctor. Once the surgery has ended, the patient can go back to the waiting room and wait for the necessary time before being able to go home. The time needed is subjective, so a patient is free to go home when he feels like it. What should I do after the surgery? Once the surgery is finished, the patient can return to the waiting room, where he will wait for the surgeon to resign, which is used to explain the post-operative therapy to be done in the days following the surgery. Each post-operative therapy is variable according to both the intervention and the choice of the surgeon. There will be a post-operative checkup that tends to be in the first or second day following the surgery, and the following checks will then be decided by the treating physician based on the patient's needs and on the operation that was performed. What are the recovery times? Another question that is often asked is, when can I resume everyday life? This, unfortunately, depends on the type of intervention that is done. Certainly, as regards to the world of ophthalmology, in the following days, there is no need to make physical efforts, and this serves to not compromise the surgery that was just performed. In most cases, after a couple of weeks, you can return to everyday life and you can also make some physical effort. Who should I contact if I have post-operative discomfort? During discharge, the attending physician leaves you all the contact details for your needs and issues you with prescriptions for post-operative therapy, both for painkillers and for antibiotic therapy. I greet you and I hope that I have answered all your questions. If you still have uncertainties, I invite you to contact the Blue Eye Clinic directly.